Hello, and I would like to welcome you to ALS Ask the Expert series. My name is Sarah Repking, and I will be your moderator for this program. Today, we will provide patient education on the topic of acute and chronic liver failure. Acute liver failure occurs when a person with no known liver disease suffers a loss of liver function very rapidly, meaning within days or weeks. Chronic liver failure occurs as a result of long-term inflammation that leads to scarring of healthy liver tissue or fibrosis. Our presenters will discuss both acute and chronic liver failure in greater detail during the presentation. Before we begin, I'd like to tell you a little bit about my background. I graduated from Vanderbilt University in 2008 with a Master's of Science in Nursing. I became a board-certified acute care nurse practitioner in the fall of 2008, and I started my healthcare career as a bedside nurse in Miami, Florida, in the surgical intensive care unit at Jackson Memorial Hospital. In 2009, I officially began working as a nurse practitioner in an internal medicine clinic, working with an underserved community in Okeechobee, Florida. Currently, I manage both acute and chronic liver disease, as well as pre and post liver transplant patients in the hepatology department at Rush University Medical Center in Chicago, Illinois. I completed my doctorate of nursing practice at the Rush University College of Nursing this past August, and recently joined the faculty at the University of Illinois Chicago College of Nursing as an adjunct clinical instructor. I'm a member of the Illinois Society for Advanced Practice Nursing, serving on their program committee, as well as a member of the Hepatology Associates Committee of the American Association for Study of Liver Disease. Additionally, I serve as an ALS National Medical Advisor, and most recently co-chaired the efforts of the Associate Medical Advisory Committee. It is now my pleasure to introduce our speakers. We are fortunate to have two outstanding presenters for today's program. Dr. Adnan Said is a faculty member at the University of Wisconsin School of Medicine and Public Health and the William S. Middletown Memorial Veterans Hospital. His expertise is in the field of gastroenterology and hepatology. He is the medical director of the VA Liver Transplant Program and the chief of gastroenterology and hepatology at the VAH. Dr. Said is the program director of the UW Transplant Hepatology Fellowship, where he oversees curriculum development and program accreditation. He is a member of several committees and organizations, including the National Medical Advisors of the ALF, the American Association for the Study of Liver Disease, and the Liver Intestinal Community of Practice of the American Society of Transplantation. Dr. Don Rockey is a physician scientist and a professor of medicine at the Medical University of South Carolina. His clinical expertise is in cell injury, inflammation, fibrosis, and end-stage organ disease. He and his team have done extensive research about fibrosis and portal hypertension. The research conducted at Dr. Rockey's laboratory has been supported by the National Institute of Health for over 25 years. In addition, he has conducted extensive clinical investigation in gastrointestinal bleeding, complications of advanced fibrosis and cirrhosis, as well as drug-induced liver injury. His impressive research has led to the creation of best practices in gastroenterology, along with the interventions and approaches that resulted in changes in clinical practice on a national level. Dr. Rockey is also an ALF National Medical Advisor. Now, let's get started with our program by answering some of the questions people have provided when they registered. Dr. Said, would you please tell us what can cause acute liver failure and what symptoms a person may have if liver failure occurs?
Good question, Sarah. So acute liver failure is a severe life-threatening condition, fortunately less common than chronic liver disease. These patients can get sick really fast, within days to sometimes weeks. And they are often hospitalized, quite often in the ICU. And at that stage, they should be expeditiously referred to a liver transplant center, as recovery may not occur without a liver transplant in many of these patients. As far as the conditions that can cause acute liver failure, the commonest conditions in the United States include medication injury and infections of the liver, particularly with viruses called viral hepatitis. The medication injury, the commonest ones we see is from acetaminophen, which is the chemical name for Tylenol, which is the brand name, but it's found in many pain formulations. It can be as a suicidal overdose, unfortunately, and sometimes it can be from an overdose that is not recognized by the patient. And those patients are often patients who are elderly, who may be taking various formulations with acetaminophen and not recognize it. There's acetaminophen in many medications, including allergy medications, flu medications, and if people start taking that along with acetaminophen, they may overdose inadvertently. Other medications can also cause it, some antibiotics, which can cause it unpredictably, even at regular doses, seizure medications, and more now in the US, use of herbal and supplement medications that are unregulated, untested, used for myriad conditions such as weight loss, mood elevation, and others. In terms of infections, viral hepatitis that can cause acute liver failure include hepatitis A, which can be transmitted by contaminated food or water or as outbreaks, and hepatitis B, which is transmitted through blood, most commonly through sexual transmission or drug use, occasionally from mothers to child. Both of these are vaccine preventable. There are other uncommon causes too, such as immune injury to the liver, such as other genetic causes where the liver may accumulate too much copper, other vascular conditions, but they are much less common as compared to the medication and viral injuries. There are other viruses, of course, that can cause the injury to the liver unpredictably. Some of them are common cold viruses. We've seen adenovirus happening in children recently in the United States, but even the chickenpox virus in rare circumstances and other similar viruses like herpes virus can injure the liver and occasionally cause acute liver failure. In terms of the symptoms, the initial symptoms of acute liver failure can be pretty mild and pretty vague and hard to recognize. They may include things like fatigue, loss of appetite, and nausea. As things progress, people will get jaundiced. They may notice, but it can be hard. They may notice that their eyes are yellow or the skin takes a yellow tinge. And as the disease progresses further, there can be difficulty with staying awake, lethargy, and eventually it can lead to confusion and even comatose. And by that time, these patients are really sick and often in the ICU. I hope that clarifies the question.
Yeah. Dr. Rockey, would you please address some of the most common causes of chronic liver failure, as well as discuss the symptoms?
Certainly. First, Sarah, I would like to say it's very nice to see you, and thank you for that very kind introduction at the outset. So I should start out by saying that there is a distinction between acute liver failure and chronic liver failure. So as Dr. Said emphasized, acute liver failure occurs in patients who have no known underlying liver disease, while chronic liver failure is when a patient has a chronic liver disease that leads to scarring of the liver and cirrhosis that ultimately leads to chronic liver failure. So there is a difference between acute liver failure and chronic liver failure. The three most common causes of chronic liver failure in the United States currently are fatty liver disease, usually associated with severe inflammation and scarring, alcohol, and hepatitis C. And in general, none of these diseases causes acute liver failure. Hepatitis C can on occasion, but fatty liver disease and alcohol usually do not cause acute liver failure, rather they cause chronic liver failure. Now, in terms of symptoms, the symptoms here are very unique. These patients present with evidence of muscle loss. They can present with fluid in the abdomen. They can present with GI bleeding, with hemorrhage, usually from what are called varices. And they can present with what we call encephalopathy, that is confusion and clouding, because the liver clears toxins from the bloodstream, and then those toxins wander up to the brain and then cause severe confusion. So those are the typical symptoms that we see with chronic liver failure. The other symptom that many people may be familiar with is jaundice. So that's yellowing of the eyes and or skin. So that occurs when the patient becomes chronically very ill.
I'm going to turn it back to Dr. Said. I think you kind of touched on this in the first question, but what liver diseases most commonly lead to liver failure?
So thanks for the question, Sarah. In terms of acute liver failure, the commonest conditions, as we were discussing, are medications or infection. And among the medications, Tylenol overdose, either intentional or unintentional, is the commonest, but other herbals and supplements can as well. We've seen example of weight loss medications like ephedra causing liver failure, green tea extract causing liver failure, usually in the loose leaf form, not in the tea bag, and supplements can as well. Certain antibiotics can as well. Now they tend to occur very uncommonly, and they can happen at regular doses. Some people are more vulnerable, others, including medications used like Augmentin, which is rare with Augmentin, but it is a very common medication, TB medications and anti-seizure medications. It is important to recognize who may be at increased risk from medication injury, especially the unintentional medication injury, or what we call idiosyncratic injury. These are often elderly individuals, people who may be malnourished, people with chronic liver injury or chronic alcoholism may be more vulnerable to accumulation because everything we ingest goes through the liver. And so medications can accumulate and become injurious to people with those conditions as well. In terms of viral hepatitis, hepatitis A, fortunately, is a declining condition in the US, but only because of vaccination. So people who are not vaccinated or choose not to be vaccinated remain vulnerable in terms of epidemic outbreaks and getting hepatitis A and getting severe liver injury from this condition. And same for hepatitis B, vaccine preventable, but it can be transmitted through blood, through sexual contact, IV drug use, and rarely during childbirth, but very preventable diseases as well. There are some less common genetic conditions, such as immune injury to the liver, what we call autoimmune hepatitis. They often can coexist with other immune conditions like thyroid disease or colitis or rheumatoid arthritis, other less common genetic conditions, which are rare but can run in families where there may be too much copper built up in the liver. They can be clotting disorders that are genetic as well, where if the blood supply to or from the liver clots off, you can develop liver failure. They're very uncommon as well, but there's a myriad of these uncommon conditions that can lead to liver failure.
Thank you. Dr. Rockey, would you address whether there is a way to find out what caused someone's liver to fail?
Most definitely. And this is actually a very important area. When you go to your provider for further care about your liver, your provider will almost certainly investigate what caused your liver disease. This is usually done by a gastroenterologist or a liver specialist, although there are some primary care physicians who are well versed in the different types of liver disease and liver failure. Initially, we will send a battery of blood tests, especially including tests for the hepatitis viruses. Hepatitis B and C are very, very important, and various other blood markers, such as the ones that Dr. Said was commenting on. In situations where we're not entirely clear what the cause of the liver disease is, we may do a liver biopsy, what's called a liver biopsy, and that is taking a small piece of the liver for examination under a microscope. And this turns out to be a very, very effective way at identifying the specific cause of liver disease and liver failure.
Thank you. Dr. Said, is it possible to be symptom-free and still have liver failure?
It is possible, especially at the early stages. Even in acute liver failure, some causes progress really rapidly to the final stages of confusion and jaundice, but some can take several weeks. And so initially, people may not have symptoms that they recognize, or they may be really mild. Who does not among us hasn't had fatigue? That could be from many other causes, but that may be the first sign. Excessive fatigue, poor appetite, nausea and vomiting, diarrhea. And then some patients may notice discomfort in their upper abdomen if the liver is swollen, for example. So some of those things can be so subtle and that they can be missed. And of course, there are many other causes for these symptoms, not just liver failure. But as things progress, then things become more obvious. If people are jaundiced, that can also be a difficult thing unless somebody notices that the whites of the eyes are looking yellow. People sometimes notice that the urine is very dark before they notice the jaundice, and that's often can be associated with jaundice as well, where the urine looks dark, like coke colored as well. That can be the first sign of jaundice. Some people have bruising, easy. Some people develop difficulty with sleep. They can go to sleep, and then other people then start developing lethargy, and then confusion is a late sign. By that time, they should be in the hospital as well. But early on, yes, symptoms can be very non-specific as they build up. So it is important to pay attention, discuss with your healthcare providers.
Back to Dr. Rockey. Are there any treatments available for people with liver failure?
Yes, so this is a very important question. And in fact, this is very different nowadays than this was, say, 20 or 30 years ago. So when I was very young and just started my training, there weren't very many treatments available. Things have changed, and now we have a complete portfolio or smorgasbord of treatments for different types of liver disease. I would say most importantly is treatment for hepatitis C. So the Nobel Prize was awarded for discovery of tests for hepatitis C, and then research that led to these treatments. And currently, it is possible for just about every patient with hepatitis C to have the virus eliminated. So we can actually not only treat, but we can cure hepatitis C. In many cases, that improves the patient's overall condition. For hepatitis B, there are great treatments for hepatitis B. We can't eliminate the virus entirely for hepatitis B, but we can suppress the virus very, very effectively. And so if you happen to have either hepatitis C or hepatitis B, it's very important that you talk to your healthcare provider about specific treatments. Then there are a number of other treatments for other types of liver diseases. I don't really have time to go into all these, but rest assured, we have the best treatment now that we have ever had. And then finally, if your liver completely fails, the best treatment for a completely failing liver is a new liver, and that's called liver transplantation. So we take out the old liver, put in a new one or a healthy one, and patients with severe liver disease can live a relatively normal lifestyle with a transplanted liver. So it's a very, very important potential treatment. And then I just would like to mention treatment for fatty liver disease, since this is rapidly becoming the most common cause of liver disease in the United States now. There's really good evidence that lifestyle modifications, specifically improving one's diet, exercising, and essentially taking better care or good care of yourself, is effective for treating fatty liver disease. And many studies have shown this now. And in addition, I should say that there are many investigational studies currently underway that are examining novel pharmacologic drug treatments. And so I expect there'll be treatment for fatty liver disease coming soon.
Excellent, thank you. Dr. Said, so let's say hypothetically I've now been diagnosed with liver disease or even liver failure. Is there anything I should be aware of, such as special diets or foods or products to avoid?
So it's a great question. As Dr. Rockey was so eloquently mentioning, lifestyle modification and a healthy, balanced diet is exceptionally important. The liver is a marvelous organ that has a great capacity to regenerate and heal, and it's always trying to do this in chronic liver disease. So a healthy, balanced diet, high in protein with all the essential minerals and vitamins through the diet is important. Additionally, if you have chronic liver disease and you are building up edema or fluid in the abdomen, your doctor may recommend a low salt diet to sort of minimize the buildup of that as well. So that's an important discussion to have. Just as important is what to avoid when you have liver disease. Everything we eat, everything we ingest, everything from the environment that goes in our body ultimately goes through the liver, which has this marvelous capacity to detoxify things, but up to a certain extent. So watching any supplements that you're taking over the counter, making sure you discuss that with your healthcare provider, any medications that are prescribed, especially new medications or medications you've been on, discussing the impact of those on your liver disease with your healthcare provider is exceptionally important as well in maintaining your liver in good shape.
I also add to avoid alcohol as well.
That's right. Avoiding excess of alcohol is exceptionally important, as well as avoiding excess of calories as well, given the preponderance of non-alcohol fatty liver disease that we are facing.
And last question for Dr. Rockey. If people are diagnosed with liver failure, is it possible for their livers to become healthy again?
Yeah, so this is a great question and a fundamentally important question. And the answer to this is yes. So again, it used to be believed many years ago that once you develop cirrhosis and scarring of your liver, that would never be reversible. Well, the evidence is that that's not true. And in fact, there's good data, or there are good data now in many liver diseases, that if you can remove the underlying cause of the problem, you cure hepatitis C, you suppress hepatitis B, you stop drinking alcohol, you do diet and lifestyle modifications, that your liver can regenerate and heal. And there are examples where people have gone from a completely scarred, advanced liver disease to a almost normal appearing liver. So that doesn't mean it happens in everybody, but it means that there is the potential for the liver to regenerate. And I should add that the liver is really the only organ in the body where that's possible. It's not possible for the heart, kidneys, lungs, pancreas, and other organs, but the liver has remarkable regenerative and healing capacity. And so it's very important that once you're diagnosed with a liver disease, that you seek treatment. And we can hope that that some patients will have reversal of their liver disease and improvement in liver function, and essentially a normal functioning liver.
Well, thank you so much to both Dr. Said and Dr. Rockey for answering these questions today. Is there anything that we didn't cover that you think people should know about acute or chronic liver failure?
I would just add at the outset that if you feel like you have a liver problem, a significant liver problem, it's very important to seek specialty care. So this is usually going to be provided by a gastroenterologist or a hepatologist. There aren't many of us hepatologists now in the United States. Most of us are situated in big cities. But I would urge you to seek out specialty care or by an advanced practice provider like Sarah to address your questions and make sure you get the best possible care that you can get.
And I completely concur with that sage advice from Dr. Rockey. The liver is a wonderful organ with a great capacity to heal and regenerate from the many insults it faces. But we can do a lot to try and keep our liver healthy. There is no easy replacement for the liver, unlike a kidney where you can do dialysis. So taking good care of our liver is important in terms of a healthy diet, keeping our weight stable, avoiding excess of alcohol, as well as getting vaccinated for things like hepatitis and B and hepatitis A. And then talking to your healthcare providers if a referral to a gastroenterologist and a hepatologist is important. One final thing, in terms of cirrhosis from chronic liver failure, it can be associated occasionally with liver cancer, which is one of the most rapidly increasing solid cancers in the U.S. You can get screened for that. So if somebody has cirrhosis or even chronic hepatitis B infection, you should consider getting screened, which you can do with something as simple as an ultrasound and a blood test every 6 months through your primary care physician, gastroenterologist, or hepatologist. So please do have that discussion.
Yeah, that's a great point. We really want to prevent, and we can prevent development or prevent advanced hepatocellular carcinoma if it's detected early enough.
Yeah, that was excellent. We didn't touch on that. So thank you so much. Well, I think with that, we'll wrap up. We hope that everyone who participated in our program has gained a better understanding about this topic and feels empowered to ask or to speak to their healthcare providers about their liver disease. The American Liver Foundation has some very helpful information on its website, which you can visit by going to liverfoundation.org. That's liverfoundation.org. You can also reach out to one of the helpline specialists by selecting the live chat feature on that site or by calling 1-800-465-4837. It also spells out 1-800-GO-LIVER. The helpline is available Monday through Friday from 9 a.m. to 5 p.m. Eastern Standard Time. Thank you so much for joining us today.